Hi everyone, good evening. It's just Damien. I am just making this video to expand on my last video and to try to clear my name again. This is really upsetting me and it's really distressing me. Uh, Basically, I've been reading again online and people are saying that I'm targeting young lasses, giving them my phone number and asking for sex. Um, Basically, I just want to clear my name on several points of what is happening, just so that people don't get the wrong impression. Basically, you'll be basically if you've got any concerns, if you can contact my doctors, if you can contact my doctors, Blacketts or the Hartlepool Community Mental Health Team or the police, they'll be able to clarify of what is going on and why it's happening. So basically, I am autistic and I struggle to make friends. I use I use social media to say that I'm looking for friends, that I'm looking for friends, I'm looking at making friendships, seeing where it goes. I'm 35, I've never dated. All of the posts that I make, all of the posts that I make, I state my age and state that I am looking to meet people of a similar age. I am 35. I am looking to meet people of a similar age. On my post states similar age. I have no intention of meeting people that are too much younger than me, because I'm uncomfortable about certain people, uh, like certain people beyond a certain age are a little bit immature and that kind of thing. I do chat to people when I do get people messaging me in that online, and if I feel that their age is if I feel that they're lying about their age, or if there's any discomfort about that, I will report it or block them. I've been on apps before, and people are on that app getting angry with me for reporting them because they've clearly told me that below that they're on the app to make friends, but they're under 18, they're 16 or 15. So I have reported that. And genuinely, with all of the posts that I am posting online, I state that friendship or friends, see where things go. I do not want a sexual relationship yet. I've never posted online to say that I want a sexual relationship. I have posted yes to say that I'm to meet with cisgendered women, women who were born female or transgender female. I am wanting to meet people who have similar experiences as myself and similar a similar journey path. I want to share similar connections and everything. As I say, before I make a post on social media, I type it up and I use AI software to re to to edit it, to read it, to reformat it basically. I have a text reader as well, so if I if I state if I've played it back through the text reader and there's something on the that reads back to me, if I find that it's not the message that I'm trying to give out, or if it comes out differently to how I think that it is, I I I re-edit it. For instance, the other night I was typing a letter up for the doctor, and it was just about some reports that I wanted changing because I'd had some reports from a previous GP and they just needed editing and changing. I had spent 2 hours trying to get the AI software to read it, to get it to how I wanted. So with the posts that I use on social media, I am posting online. I am posting in AI software first, getting them to edit that. There is times where I rewrite profiles regularly just to try to make it a bit more eye-catching, a little bit more flamboyant, but more so that I can stand out. Uh, basically, uh, have I ever given a number to a lass? No, no, I have never given my number to a lass. I have never given my number to a lass. I'm not confident at talking to the females and that in that way because I often panic that they've already got a partner, or that that I'm going to get rejected, or that the fact that they might be under 18. And I know that a lot of people my own age go out drinking on a night out, asking lasses and that out. And I don't want to be in that situation of going out, hooking up with someone, and then it turns out they've lied about their age, or the fact that they've lied about their age, and that I don't want to be in that situation anyway. But genuinely, I don't drink. I have a couple of weeks, but that's one with a meal or whatever. I do. I have been to one speed dating event in my life, and I've been to one speed dating event in my life, and that was at Newcastle and was unsuccessful. Have been on dating sites since 16 or 17, but been but got blocked or abused back on them. And I have, hand on heart, only asked one lass out face to face. This was years ago and she didn't swing my way, meaning she was gay. But I'm not saying who it was or whatever. However, the scenario that built up to that was the fact that I knew her for years through volunteering that I did. So that was why I'd asked I'd asked her out. But other than that, I've never asked anyone out face to face. I make videos on YouTube about the gender journey and about the autism, so that people so that people can understand and people like me don't have to feel alone whilst they're reading reading whilst they're going through similar journeys or similar journey paths. When I was first asking, when I was first exploring things with the autism or with the gender, it was like I've got no one to talk to, and I've got no one to talk to about this, about that. And I know that there's been I know that there's been comments as well on the fact that I disclose autism and the gender stuff in most of my posts. I am not doing this for attention, and the reason why I am doing this is because in the past I have, whenever I've applied for something, looked into something, if I've not disclosed anything straight away, I end up I end up being told that they've either made a mistake or that my needs are too specialist and too complex for me to work with, or they don't want to work with me for this reason, for that reason. I'd rather be upfront. I'd rather be upfront with people about who I am and being honest about being who I am, so that it doesn't waste my time and it doesn't waste their time working with me when they don't need to work with me. I've had job interviews in the past where I've not disclosed my medical history, and the medical history, and I got asked to bring it in. Was working with them about 2 days, and I got sat in a classroom, in a training room, sorry, about 40 to 45 minutes after everyone had left, and then they told me that I should never have got the job or been given the job. So I'm trying to reduce some of getting let down, and what I'm trying to say is I'd rather know in advance that I'd rather disclose everything in advance, so that people so that people so that I'm not building my hopes up for anything. Like, I'd rather be let down straight away. I'd rather be let down straight away instead of instead of instead of building myself up looking forward to it, and then it's like you've got yourself built up, you've got yourself at the top of the ladder, and then it comes crashing down. I'd rather be honest about who I am and about journey path, so that people can know who I am straight away, so that I'm not let down, or that it's not wasting my time and their time. There has been a couple of posts stating as well a few weeks ago that people had seen me in A&E in December time last year, about Christmas time, whatever. To be totally honest with you, the follow the previous week I'd been to and I'd been to James Cook A&E the previous week on the Monday, and my levels were raised on my stomach, and the levels were raised on my stomach, and because I get pancreatitis, it flares up when I'm worried or upset, and that I went back on the Thursday, and it was like my levels my levels had dropped again. My levels had dropped again. On the 9th of December, I went to see my doctor. I was thinking about going to James Cook first, but I'm like, feel achy and I felt tired. I didn't want to waste Amy's time. Didn't want to waste Amy's time. So I went to my doctor's and saw one of the doctors, not my main doctor, but my other doctor. I've only seen two doctors there and a nurse. But yeah, I'd seen the doctor and they're like, I think it's anxiety. She thinks it's anxiety. She gave me some mebevrine for my stomach and it was like, gave me some mebevrine for my stomach and, and yeah, they gave me some mebevrine for my stomach and I'm like, took one or, and it like settled it down a little bit. But that day I was laid on here, playing on this, and I'm like struggling to concentrate, struggling to stay awake. And I, 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 uh, felt sick that night, and I'd felt sick for ages, and that had to make myself sick. Sick about 4 or 5 times on the floor down there, and ambulance came. I don't normally, if an ambulance comes on a night and I've got chest pain, palpitations, and the obs are fine. I don't go to A&E because I know it's my anxiety and I know that with lack of sleep that I'm gonna I'm gonna be it's gonna be making it worse if I stay up. So ambulance came, had a heart rate of 140 nearly and a temperature of 38, and I'm like 11 o'clock at night. I got brought in and put in the waiting area at got the bloods done in ECG. They had to redo the bloods when they went into for the ECG, and that the the uh the bloke that was doing my ECG came. It said 11 hours wait. So the bloke that did my ECG came out at 1:41 in the morning. I knew the earliest that I that I I knew the earliest that I'd be seen was 10 o'clock in the morning, so they came for me at 1:41 in the morning, and they'd asked me to move. They'd asked me to move, but that was because I was too ill to be in the waiting area. That I knew then, when they would take me down, that they were keeping me in, and that week I was on Ward 34, the cancer ward, and another ward because they didn't know what was up with me. So yes, I was in hospital in December, but I was ill and I was asked to move because I was asked to move because I was too ill to be in the waiting area. I had a heart rate of 140 and a temperature of 38, and my immune system was low. And there is time when I am out, I do try to socialise with people if I can, like other people socialise in waiting areas or get talking to each other and that kind of thing. And with me, with the autism, I get extremely anxious in busy public places. Sometimes you just need to chat with someone about the weather or chat with someone about different things just to try to keep your mind off things and just try to keep yourself distracted. Has been like there was a few weeks ago I was in A&E and there was a woman next to me talking about her son with autism, and the woman in front of me was talking about her brother with autism, and I was saying about how I've got autism and things get misinterpreted. So I do try to give advice to people when I can if I socialise or whatever. It doesn't mean that I'm a bad person. I don't try. I don't go out there targeting people that are under 18 or targeting people of a specific age. To be totally honest with you, I don't really want to be socialising with people under 18 anyway, or even even older than that, because I find that a lot of people are immature, and I am not really comfortable talking to women of I'm not really comfortable talking to women or talking to people beyond be, be, before a certain age. For example, for example, when I started volunteering or when I started social groups in the past, most of them, some of them don't exist anymore, and some of them have had changes since COVID. That's why I've stopped going. But genuinely, members of staff can verify this, that I have had, I have often gravitated towards the older people, and they believe, and I believe, that I'm more comfortable talking to older people because of the fact that I was bullied at school, and I find older people easier to talk to. And I've had it before with doctors and mental health staff as well. I'm not as comfortable talking to the younger generation as as what I am talking to the older generation. In fact, I'm more comfortable talking to the older the older generation than the younger generation. And I'm I'm like, yeah, staff can verify that. People that I used to volunteer with can verify that. And I found people are more understanding of a certain age and that kind of thing. And I wouldn't, to be honest with you, if I get on a bus or whatever and there's people on there that are under us, if the primary, it say there's people on the bus and most of the target age range is below 18 or below a certain age bracket on the bus, I do get really uncomfortable about about talking to them, and it's like it's I do get uncomfortable about talking to them. I do get uncomfortable about this. I do get uncomfortable about that. And the reason why I try to post on social media about the fact that I'm looking for friends, I'm looking at meeting more people my own age, is to try to be a bit more, is to try to protect myself and to try to cover my own back or to make myself a little bit more safer. I wouldn't feel safe talking to, like, trying to make full friendships with people and that whilst I'm out in public or whatever. You like stereotype situations. Is this person under 18? Red flags. Is this person got a boyfriend or a partner who's gonna target me, red flags, and don't want to be I don't want to be going down that route anymore. I, and it's like part of that's a confidence thing, and part of that is the fact that I'm not good at conflict or confrontation. I'd rather try to post on social media and that's try to help. Other, I'm like, I'd rather post as well as I say so that other people can understand and not feel alone as well. And it's just about, it's basically, I post on there about jobs and that as well. Looking for work. I'm looking for work. I'm looking for training and that. I've had bad experiences in the public eye. I've had bad experiences in the public eye, and I'm trying to post down other ways, other unconventional ways, so that I can get noticed and not be targeted physically or whatever. Um, as I say, I've I've had I have paid £75 an hour with a communication therapist who's also autistic that has done reports that can back up what I'm saying, or some of what I'm saying, or most of what I'm saying. My doctors, my doctors are aware of everything. The doctors know why I do this, why I do that, how I'm trying to protect myself, and that and that that I'm genuine. Basically, there has been mistakes with female members of staff in the past. However, that was more the fact that I was trying to protect myself. I'd seen my previous CPN on social media. I'd let the crisis team know. I'd let the crisis team know that I wanted to protect myself. I was scared of this happening. I was scared of that happening. So they'd advise me to let the mental health team know that they'd advised me to let the mental health team know that I'd seen her on social media and could they take any precautionary measures. Sent screenshots of what I found, screenshots of me deleting the screenshots, of me deleting the screenshots, and then the branded me danger one before that, after that, even though that I was trying to follow crisis team advice and protect myself by sending screenshots of what I found, what I want them to do, and screenshots of me deleting the screenshots of me deleting the screenshots. So that's why I'm trying to protect myself and that kind of thing. And there has been a couple of incidents with the doctors about boundaries and that kind of thing. I've got female doctors now on the phone with me. It's just that there has been a couple of incidents where um I I got worried about the fact that my e-consults were getting misinterpreted. So I'd another e-consult sent another e-consult to try to protect myself, but then they were getting too many e-consults, so we've discussed it, we've came up with ideas, and we've came up with plans to try to get this resolved. I I also bought my doctor some flowers and a card when we first met because I didn't need to. She said I just need to remember who she is, that she's my doctor and that kind of thing. She's saying I didn't need to, but I felt that I had to do it because I've been in a situation for years where I was getting passed on from one person to another with the care, and that when I met her, it was like one of the first things she said to me was, "You've been totally misinterpreted in the past. She's wanting to do this with me. She's wanting to do that," and I felt the huge weight lifted off my shoulders. I finally found a surgery that I can work with and that kind of thing. So it's trying to understand understand what I want and what other people want from me. I am I am trying to work with my communication therapist on boundaries and on social norms, social behaviours about what is accepted from different organisations. However, the problem is with this is that she needs professional input. She hasn't got all the responses back from professionals yet to try to get this finished because the problem is that it may be okay disclosing physical and mental health issues with your doctor, but it's not okay disclosing physical symptoms with your mental health nurse, or you might be okay to talk about this mental health condition with this doctor, but it might not be okay to talk about this condition with this doctor, or vice versa. And it's like it does get confusing where even within even within the same trust, the same organization, different members of the team have different boundary limits and different boundary thresholds. You might you might be you might be okay talking to one doctor about a certain mental health condition, but it's not okay talking to another doctor about that social mental health condition. Or, or if you're in some places, it might be okay talking about male genitalia problems with a man, but it's not okay talking about male genitalia problems with a lady GP. So it does that does get confusing with me. So I'm trying to work with a communication therapist for advice about boundaries, social norms to help me on my way. Also, also it is quite hard and difficult knowing about what is accepted, what isn't accepted. Also, also there has been a few posts made about me being in court. Yes, I have been in court. The On the 7th of July, I was in court 2 days after I got back off holiday. What had happened? The reason why I was in court was the fact that I had some distressing thoughts in September last year. Safety plan states to ring the crisis team. The crisis team are like, we don't deal with this, you have to go through the police. Police were passing me back onto the crisis team passing me on to the police. And I got arrested for misuse of the police number. And I rang another organisation for help and support because I was extremely upset and extremely nervous. However, that person told the police that I was asking for help and support, that I was calm, but they were extremely upset and distressed by what I'd said, even though that I was asking for help. So the fact was that I had to plead guilty for that. My solicitor, not for that, my solicitor did state at the time, my solicitor did state at the time that she's known me for years, and if I hadn't have been let down by services and they were doing the jobs properly, I wouldn't have been in court. I am trying to take proactive steps to get things back on track. Also, I do get thoughts to self harm still and thoughts to overdose when I am upset or distressed. The other week, a few weeks ago, when I last saw my doctor, I took a small case in with medication that I used for PRN. Uh, and she'd got a bit of a shock of her life because she wasn't expecting me to bring it in a case. But she, she was like, we can dispose of it. we can dispose of it this time, but we can't do it all the time. And I'm like, I wasn't asking her to dispose of it. I was going to take it to the pharmacy over the road. But it's about understanding the risk factors. I am trying to protect myself and preempt myself. I am trying to protect myself with the way that I communicate on social media. As if you look back at my posts, or if you've got screenshots of posts and that I've posted in the past, you'll be able to see that I state clearly that I'm 35 and I'm looking at meeting people around a similar age. Also, the posts that I do post are done by myself, but I use AI software to help to try to streamline it in a safer way as possible. I also use AI software to uh to basically do the ads that my dad asks me to sell furniture and that for him and other stuff. So a lot of my posts online aren't just me writing it and posting it online. I'm trying to be a bit more methodical in the way that I deal with it, and a bit more perceptive. I use AI software. I've got a text reader saved onto my laptop. So when I've finished typing up on AI software, I read it back to me on the AT chat software. And if I'm not happy with it, then I'm changing, I'm having to change it again. There can be times where I'm having to use more than one AI software at a time to try to get this rewritten, to try to get that rewritten. But genuinely, if you go to my doctor's, Blacketts Medical in Darlington, or if you contact the Hartlepool Community Mental Health Team or Darlington Association on Disability on Advocacy, they will be able to clarify that I am taking these steps to protect myself, that I'm wanting to, I'm trying to make friends, I'm trying to socialize because I'm socially isolated. I don't have, I struggle to make friends that are my own age, and I don't have a social care package at the moment. And I was open to social services a while back and got discharged, put an appeal in, and that was turned down. And I've got another application in again. However, most of the stuff that I do, I feel socially isolated with because I'm having to do it on my own, or the odd time my mum goes with me. And I would like to socialise more with people my own age and try to develop friendship groups, to try to develop friendships, to try to get out and do things together with other people. I do use websites like dating sites. I do use Meetup. I do use events, right? And I do use I do try to apply for different groups for LGBT, for uh for autism, for Asperger's, or whatever. And the problem is that you give them evidence, you give them the screenshots of what you give them the reports, sorry, of your autism. You give them reports of your gender dysphoria or reports of what's gone wrong, why it's gone wrong, and they're like, you need to specialist to complex. We don't want to work with you. Also, with vulnerabilities and that from different groups that have been highlighted, that's because in the past, that's because of the fact that I get plans that that's because I get plans that are given to me that are misinterpreted. Or, for example, you can ring, your safety plans can state to ring the crisis team. Your safety plans can state to ring the crisis team, and then it's like the guidelines, recommendations only. This needs to be this organisation, this needs to be that organisation. However, however, because of when you are looking for support down other avenues in the future, they can contact that organisation. That organisation can say that we felt threatened, we felt intimidated, that we've had to call the police, we've had to do this, we've had to do that, and then that looks bad on me. But it's like the problem is my doctors are aware of this as well. As I'm saying, that a lot of the times the problem is with this is you get told to contact the crisis team. They're like the plans are guidelines, recommendations only, and they're like it's a police matter. So then it looks like I'm making threats or whatever when I am trying to follow the safety plans. It's making me dizzy thinking about it. So I it's confusing. The doctors are aware, the mental health team are aware, but it's like you get reassurances. Don't worry, don't worry that we're not. Don't worry, the safety plans are going to be changed, and this isn't going to happen anymore. That's not going to happen. And then it's like, and then it's like square one, and some, and like last week, I'd rang the I'd rang a service for something, then they told me to ring someone else, then they told me to ring 999. The police were like, we're not aware of this, we don't need to be coming out, we don't need to do this, do that. Gave the ambulance service the exact information that I gave the police, and then it's like the paramedics, the police still came with the paramedics, so it's like, why have the police came out? Why have the police came out when why have the police came out when the the crisis when they've told me that they weren't going to come out? So yeah, I'm just a little bit frustrated really that I'm trying to get things back on track and things getting misinterpreted and that kind of thing, but I am trying to keep everything legal, and I'm trying to keep everything legal. I'm trying to keep everything above board, and I am trying to follow safety plans, but it's a little bit hard at times because it's it's like it's like getting misinterpreted again, and I'm not wanting things to be misinterpreted. I have autism, and I'm on the gender journey. I'm proud of the fact that I'm Damien or sometimes Danielle. I'm never happier than I am never happier than I am now. When I've got the dress on, when I've got the girls out, the girls, when I am like this and I walk past myself and see my reflection in a mirror, in a window, in a puddle or something, I'm like, smiling at myself. Yeah, this is me. This is the person that I feel I am inside. This is the journey I'm on. I'm never prouder. I just want to get myself on the next step of the ladder, meet new friends, meet new connections along the way. I know that I post in social media that I'm wanting to meet trans women and that kind of thing, but I'm wanting to meet people that I'm wanting to meet people that are on similar journey paths to myself and who I can connect with. When I have been doing the communication therapist, when I've been doing the communication therapist work, the lady that I was working with is autistic, and we're like, whenever we did a session, 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 I found something new about her that we're like, yeah, we've got this in common. We've got got that in common. Not because I fancied her or anything. It was like knowing that I'm not alone. And it's like, no, yeah, I'm working with a professional that's got this in common with me. We're on similar journey paths, and that we've got the same expectations of what we want for care and that kind of thing. However, I've never experienced that with the gender identity side or with the Danielle side. I've experienced it with the autistic side, but I've never experienced it with the the gender side and the Danielle side, and I'm wanting to explore what my own strengths are, what my own weaknesses are, and explore more what my own strengths are, what my own weaknesses are, and if someone has tried things, I'm wanting to know more about what their journey path was to try to inspire me, to try to give me ideas of myself. And I'm like, if their ideas don't work, I don't have to use them. But the main reason, like as I say, when I'm posting online, I'm trying to make more social connections, and I'm trying to make more social connections, and I'm trying to know how I can explore myself as well through different people's ideas, or and try to come up with my own. So yeah, um, genuinely, I am not after sex. I'm not after sex at this moment in life. I'm after a little bit of companionship mainly, or with people similar to my own age. I'm 35, just to be clear about that. And with people similar to my own age who are on different or similar journey paths that we could maybe share activities with or share connections with. It doesn't mean that I'm wanting to date. It doesn't mean that I'm wanting wanting sex. I would like to date eventually, but don't want to don't want to I don't want to jump straight into meeting someone and doing things that I'm not ready for yet. I'd I'd rather my first time be with someone that is special, or with someone that's special, or with someone that, like, yeah, with someone that's special. I want my first time to be right, and that kind of thing. But I'm not looking for that at the moment. I'm not looking for that at the moment. I'm wanting to meet new people so that I can share like experiences with, share my journey with, and to try to inspire other people, for other people to inspire me, for me to try to inspire other people, and that's the purpose of the channel. That's the purpose of why I want a career in the media industry, because I'm wanting to share my experiences so that Joanne across the road doesn't have the same experiences as me. I was using that as an example. There's no one in my street called Joanne. So yeah, it's a little bit hard because I'm trying to use social media. I'm trying to be congruent to myself. I'm trying to please this person. I'm trying to please that person. But when I'm trying to please too many people, a lot of people get upset, and a lot of people get upset. A lot of people get uncomfortable with what I do. And when I try to if I try to preempt things, or if I'm trying to plan ahead for things going wrong, I try to put measures in place, and then things end up getting worse and escalating themselves. And I'm not trying to be, I'm not trying to be like that at all. I don't like the fact that I'm unemployed. I don't like the fact that I don't have many friends, that I don't have a social circle. I don't like the fact that I'm getting bullied. I don't like the fact that I'm getting victimized at the moment. But I am never prouder than than how I am now. I Danielle brought out the confidence with me. Danielle brings out the fact that I can cope with things better. Danielle Danielle brings the smile to my face. Danielle brings out a better person in me, and I'm wanting to share that. I'm wanting to share that person with other people, and I don't, I, I don't want to be going out. I don't want to be sharing the fact that I overdose all the time, and I self harming that all the time. I don't want to be overdosing anymore. I don't want to be self harming anymore. But the Danielle side has helped with that. The the Danielle side has helped with that, and doing what I'm doing on social media, and that has helped as well, because I'm trying to inspire other people. I'm trying to bring out the best in me so that I can bring out the best in other people. I know that things had gone wrong with communication and that kind of thing for years. And I'm like, I know things have gone wrong with communication being misinterpreted for years. That and like last year, I got the chance to start my ideas and to bring out my ideas. And when I'm working with a care team, or when I'm allowed to try my ideas, it works. It works. If my ideas haven't worked, if my ideas haven't worked, I discuss it with the doctor, I discuss it with the mental health team, that this hasn't worked. Why don't we try this? Why don't we try that? But last year, after I knew that things were getting misinterpreted for the mental health and that again, I was like, why don't I bring in the my communication therapist who sees things similar way to me, similar way to me, and sees things for that's understanding and that kind of thing. And one of the things that I found helpful with her was the fact that she's using personal experience to work with me as well. It's that not like in the past I've had professionals stating that they're a professional with autism, they're a professional with gender, but they're like, I don't, I'm not behaving in the way that they'd expect because of what their boundaries and what because of what they not boundaries, the word because of what their professional experiences taught them, but because of my mental communication therapist having personal experience, she looks at things a different way. I hope that being as honest as I can with this video on the fact of why I'm using social media, on the fact of that this hasn't worked, that hasn't worked. I'm hoping that I've got across the message on the fact that I'm using AI software, I'm using text readers for trying to amend posts before it gets posted. And I'm hoping that you can have a little bit more insight into this about the way that my mind works. Basically, that I'm on social media and that to try to help other people to try to develop more of personal understanding of myself. And I just hope that you've you've enjoyed this video. It's a little bit upsetting and distressing tonight, but it I feel better making it. Thank you. Bye.